Hi, I'm Dr. Edwin Charlebois. I'm a professor of medicine here at UCSF, and I'm one of 3 principal investigators for the NIMHD Research Coordinating Center to Reduce Disparities in Multiple Chronic Diseases, RCC for short. I'm an infectious disease epidemiologist. My career's been focused on public health and particularly around community-engaged research and helping to build research data systems, doing capacity building in the communities and in the countries like Uganda and Kenya that I'm working in. And so that's been one of my strengths that I bring to the Research Coordinating Center. So the Research Coordinating Center has 3 multiple principal investigators, each bringing different strengths and experience. We're able to draw upon that expertise in numerous communities, African American communities, Native American and Alaskan communities, Asian populations, individuals who are parts of sexual minority communities, and those experiencing homelessness. So like all of those areas of expertise can be brought to bear on this multiple chronic diseases disparities research initiative. The Research Coordinating Center to Reduce Disparities in Multiple Chronic Diseases has 4 aims. 1 is to build and support a consortium of these 11 disparities research centers funded by NIMHD across the US. 2, to help collect common data elements on these social determinants of health from all of the 30+ studies that are going to be going on within this initiative, and from that to build a data warehouse that the consortium and future scientists can use to study disparities in multiple chronic diseases. 3, develop an educational network to help develop the careers and the scientific training of underrepresented minority scientists who are in early stages of their career. And 4, to help support and monitor a vibrant community-engaged research. The Multiple Chronic Diseases Disparities Research Consortium is very diverse. It's composed of these 11 individual research centers, and even within an individual research center, there's diversity going on in terms of the research that's happening. Each center has between 2 and 3 intervention trials that they're doing, and they're focusing on different populations, different diseases. One of the requirements of this particular initiative is that these intervention trials focus on the common drivers of multiple chronic diseases. So each of these centers is studying more than one chronic diseases and those upstream drivers of it. There's some very amazing projects going on, from nutritional interventions, alcohol reduction interventions delivered through African American barbershops, just an incredible diversity of things. This is one of the strengths, I think, of this initiative. I think there are going to be a number of results that come out of this Multiple Chronic Diseases Disparities Research Initiative. 1, we're going to learn a lot more about what works, why it works, and who it works in. Can you really intervene on multiple chronic diseases at the same time by focusing on those upstream drivers of social determinants of health? I think this initiative is going to change how we do research and how we do community-engaged research on multiple chronic diseases. And I think it's also going to change the way we identify and support new investigators who want to focus on this field of disparities research. The long-lasting results of this initiative, I think, are definitely going to be felt not only at the research level, but also in the communities. Focusing on sustainable priority interventions that come from the community, some priority lists, and some of the best minds in disparities research in the United States.